Advances in Organ Transplantation in Bioprinting by Sladek. This report examines 3D printing organs for transplant as an alternative to traditional live and deceased donated organ transplants. The traditional process of transplantation provides many opportunities for the transplant patient to reject the organ or require an infection because of the anti-rejection medication that suppresses the immune system. The new technology will allow the patient to not take the anti-rejection medication and lower the chance of acquiring an infection or other sickness, greatly improving the success rate of transplant patients. The reason I found this topic to be so interesting began when I found out my best friend was in heart failure and needed a heart transplant. This opened up my eyes to the world of organ transplantation, and while it is such a life-saving process, it still has many flaws. Advances in medicine, particularly in organ transplants, have seen progress with bioprinting technologies. Bioprinting is the process of using human cells or tissue to grow and form organs like bone, skin, kidneys, hearts, and many more. Researchers scan the patient's organ to determine personalized size and shape, comparing it to our current process of transplantation, which takes organs that have been donated while living or after death and implants it into the patient in need. As of March 2020, over 112,000 people are on the national waiting list, and only 3 in 1,000 donors die in a way that allows for organ donation. In the 18th century, researchers experimented with organ transplantation on animals and humans. There were many failures over the years, but by the mid-20th century, scientists were performing successful organ transplants. Transplants of kidneys, livers, hearts, pancreases, intestines, lungs, and both heart and lung are now considered routine medical treatment. Important medical breakthroughs such as tissue typing and immunosuppressant drugs allow for more organ transplants and a longer survival rate for recipients. The most notable development in this area was John Borrell's discovery of an immunosuppressant drug in the mid-1970s. There are 2 types of organ donation, deceased and living donations. To become a deceased donor, you must either sign up online or in the DMV while renewing your ID or license. It will be marked on the bottom of the back of your ID card. Most cases, the donor is deceased, except in living donation, which can occur if the recipient is in need of one of or a portion of a kidney, liver, lung, or part of the intestines. Donors and recipients must be matched according to certain criteria, a few being blood type, body size, patient's condition, and distance. The matching process usually takes many weeks to many months in order to find the best match. After the actual transplant surgery, there are many checkups to ensure there isn't infection or rejection. Many medications are required. Immunosuppressant medications must be taken, which make the patient more susceptible to colds, viruses, and germs. On average, 20 people die every day in the United States due to lack of available organs for transplant, and a new name is added to the national transplant waiting list every 10 minutes. The number of people in need of a transplant continues to rise while the number of donors stays constant. There simply aren't enough donors to meet the given demands. Another big issue with the current method of organ transplants is the risk of rejection and effect of anti-rejection medications. Rejection is the body's way of protecting itself against a foreign invader, such as infectious germs. Rejection can happen when the body sees the transplanted organ or tissue as a foreign invader and attempts to destroy it. Immunosuppressant or anti-rejection medications that prevent the body from rejecting the transplanted organ are an important part of life after transplant surgery. Transplant recipients may be more vulnerable to infections and find it more difficult to recover from certain infections and illnesses. Bioprinting is now figuring out how to not only print an organ, but make an organ for a specific person, size, shape, and placement in a person's body. The organ is printed using bioink. Bioink uses cells taken from the patient. This ensures that the printed organ will be compatible genetically and won't be rejected once it's transplanted, in the patient's body. 3D printing began in 1981 with the patent for a laser beam resin curing system, built and cured layer by layer. By the early 1990s, they introduced the next generation of materials used for printing, called nanocomposites. In 1999, scientists used a 3D printer to print a synthetic scaffold of a human bladder, coated it in cells, and successfully grew working organs. Bioprinting hasn't yet become widely available. It is still a work in progress, but advancing more and more every day. Many new advancements are happening. Most are still in the preclinical trial stages. In the next 10 years, we expect to see many changes happening in making 3D printed transplant organs more widely utilized. This new technology will allow the patient to not take the anti-rejection medications and lower the chance of acquiring an infection or other sickness, greatly improving the success rate of transplant patients. Bioprinting will also greatly reduce the wait for a transplant by cutting down the screening process for a suitable organ, and the organ will be printed with the recipient in mind. It will be made to fit them perfectly. These advances will change the way the medical field works forever. One of the big challenges I faced while completing this white paper was researching information on successful 3D printed organs and if they'd been transplanted or not. Once that information was found, I couldn't find any dates or anyone to credit for doing it first. Another struggle for me was formatting the document to increase readability as well as visual appeal. Through my research, I did find out a lot more about the history of 3D printing in general. I also learned more about everything that was involved with the whole 3D printing organs process, and that there was some special bioink that contained specialized stem cells to print organs. If I were to give advice to a future student beginning this project, I would tell them to stay up to date with all the weekly readings and work on the report a set time every week. Never skip a week or get behind.